like some of us just wanted, I guess, just advice on like what we can do to like broaden the conversation and like to start the conversation.
Yeah, no, it's a good point. Like you said, I know services, where they are at the moment. Like you said, I always say, like, just engage with father, have a conversation. It's very much finding what's in your area. It could be like dance groups, or when it comes, engaging with specialist perinatal mental health teams. I would certainly, that's one thing I'll definitely do, and try and find out, create your own what's around you. So when I set up a group called Fathers Reaching Out, I was at I was to me in the centre sort of thing, and then I had like counsellors. I was engaged, surrounded by mental health services then. So some dad wanted to talk about. I was saying dad are bipolar, so I said okay. Make sure you speak to somebody who knows with a group. So, but antenatal classes. I think if we need to support dads in that antenatal period, encourage dads to give us smoking, because if you don't, and mum is the only one encouraging, when mum gets post-depression, well, dad's still smoking, give me a cigarette, I can't cope, so we got to, all these things, encourage dads to get the counselling. If you're struggling with mental health before you become a dad, see IAP services before, because then it may not be so overwhelming, if that makes sense, rather than deal all the things you haven't dealt with as a new dad. And then you've got the lack of sleep, find out resources for, dads about sleep consult, loads of things. But I think, I know it sounds simple really, but having a conversation, like I spoke to a dad the other day, I just had a conversation, and something he probably would never add as well, so.
Thinking about what I was on about earlier, about asking mum or dad what they would like to be taught, named by when you're talking to them. There's also been quite a bit about, parents that are caring for children with complex needs, and they don't want to be a nurse for their child. They just want to be mum. They just want to be dad. And I think, but both mum and dad can put a lot of pressure on themselves to do everything because it's their child and that's what they need to do and that's the expectation. But sometimes they're crying out to just be dad and just have that time. And I think how could we as nurses, thinking about more like on a hospital ward, I would say, wouldn't you agree, Lucy, that how we could give that time back when we're there, where obviously they're so used to doing everything for their child at home because they're expected to do a lot more than maybe other parents are, but giving them the chance to be dad even in that time when they're back in, say, a hospital setting. How do we manage those situations and still give them that opportunity and the chance to say that they're not okay with, maybe they do just want to be dad, and that's okay if they don't want to be a nurse to their child. That's not a bad thing, but I imagine that a lot of dads in that situation will put a lot of pressure on themselves. And how could we help? I think Lucy might be able to add something to that, maybe, hopefully. It's a bit of a ramble.
No, it's great. Lucy, you okay?
Yeah, so following from that, obviously there's like a lot of pressures like on like fathers to be like the perfect father, and like even if like they're struggling like themselves or like the child say in hospital or whatever, like what would you say to like what would help in like that situation? Like what could we do with like nurses or like healthcare professionals to like help?
I know it sounds really. Obviously I worked on a ward, obviously different project, obviously on the NHS wards, and just have a conversation. Reassure him. It's okay. Make him. Is there any concerns he has? Because that's one thing as well. Because like I said, I know going back to birth trauma, whatever, but sometimes there's no communication there. So dad is overthinking. Oh my gosh! Just by reassuring, like a debriefing, or in as such when it comes to after that trauma sort of thing. But have a conversation. Is anything help with open-ended questioning. Pausing, listening. Listening is the best skill you can use as well. Listen and address then sort of thing. So information is always great. Just something odd. Even about it could be something simple sometimes. I know it's really easy. Something that one dad maybe he's got what he's got to deal with is hard enough. But the one thing is really playing in his mind, and it's triggering all this stuff off, is he needs financial help. So once you address that financial help, what he's dealing with, okay, it's still bad, but it's not as bad as if. And sometimes the smallest thing can trigger everything off. I mean, oh, it becomes overwhelmed. I can't cope with that now. I'm just about managing with this, and that's when something like it could be as simple as a bill. I know comes through a door. I know it sounds really trivial sometimes. It just becomes overwhelming for him. But going back to the question, really, it's just as health professionals, just engage. Address what you need. That need is. And like I say, going back, certainly, I know a good friend of mine, Scott, I work with, father 7, and he got 3 children with autism. And all he wants to do is, he's a dad, and he just wants, the stigmas as social, well, parents sometimes go through as well, just by seeing, how professionals sometimes react to them because of the situation then as well. A good saying is never look down on anyone unless you're helping them up. I mean, don't look down on them just because you never know what their experience has gone through, whatever, and just have empathy and understanding. That's all you can do as health professionals and nurses. And if you've got empathy and understanding, you're on the right track.
I was talking to a dad the other day who said that one thing from COVID that they've really enjoyed is the fact that a lot of their appointments for their child has been done remotely, and this child has, say, needs where they go to the hospital maybe like twice a year, I think. But he never gets to go to the appointments because in his situation, he is the breadwinner and the mum takes the time off. And, he's been able to be part of this because he's been home, so he's just scheduled his lunch for the time around the time that the conversation might happen, and he's been able to engage. And it's not that mum wasn't filling him in or he didn't have the same concerns as mum. He just never got to sit and talk to the health professional, or the health professional never met them. And for him, he was saying that it felt great to be able to be part of it and be able to ask his concerns and his worries, rather than say his partner sat there going and dad thinks, or and the health professional maybe sat there going, well, does dad really think that? Or
that's
they
a really good point.
they don't know whether dad's worried about those, or things like that. And I think one thing that this dad was saying was he wishes that they could do more like that. He understands that they need to see the child, maybe because we wait and hide them in hospital when they go to clinic and things like that, and it's always good to have a face-to-face. But he just really appreciated being able to be part of the consultation. And maybe it's something that we need to move forward with, even if it's just that mum is there with the child, but dad's like phoned in while they're doing it, so that they're involved more, because I think it was just one of those things where you just think communication and dad being able to be sat there as well. You could see that the dad just felt more included, even though obviously I think that family unit talked a lot about what was going on and the appointments that they needed to do. And maybe COVID has taught us something about how to include more.
Absolutely, yeah. I do. It's a good point. Communication. When the relationship failed because of the lack of communication between both parents, and I do work with a midwife online. We get about 40, 50 parents on Zoom. So we get that. That's when, because mum's overthinking over here, dad's overthinking over here. I give an example. One example. Dad's got witnessed that trauma. His wife got severe post-impression or whatever's going to happen. Then now he hasn't been debriefed or engaged in services, and now I don't want another baby. Mum's over here thinking, oh gosh, all body image, all the things we know when mums go through as well. He doesn't want sex with me because I've just had a new baby. But in reality, because they haven't communicated each other, dad doesn't want sex because he doesn't want to have another baby because he doesn't want his wife go through trauma. So we start overthinking all these scenarios. So communication, getting the parents to communicate and being involved, that is another a way to save relationships as well, definitely. So communication amongst parents is huge. Ellie Taylor in Australia, I would definitely recommend you have a look at around communication on this. It's done amazing work as well.
And then I was thinking, obviously I know that it took for quite a few years for you to realise that your mental health was declining. But what kind of things for you, Mark, were kind of if you look back now, what kind of were the signposts? I know we've talked about behaviour change and things like that, but what were the things that kind of stand out now if you go, if I'd only known that, and if only maybe someone that was interacting with us had known that?
Yeah, from personal experience, I think having ADHD helped. Getting diagnosed, at least I knew what I was up against. You're going to come across a lot of parents who have never been diagnosed with ADHD, especially my generation. Then that would have helped. I would have get us, understand what I'm up against for years before I become a dad. I think I would have education in the antenatal period, the importance of bond and that attachment. I think that'd be another one. Skin to skin, baby massage, all the things we know about. I think I understand about post depression or birth trauma as well. I think, but looking back at my positive coping skills, replacing the negative coping skills from alcohol to actually CBT. Like I said, what works for me might not work for you, but CBT, walking, mindfulness meditation, music therapy, things just to relax the brain so it doesn't get overwhelmed. Writing your thoughts down on paper works for me as well. That may not work for others. Mood diaries, these sort of things. So we give people, not overwhelm them with those resources, but find out, they will try this. I get dads saying, counsellor don't work. Well, I say, have you tried this counsellor? It's working now, go, because you haven't got that rapport with that person. We've got to make a myth, break all the myths out. Even the same thing, like, our dads won't get the help because they're worried it's going to affect their employment. And as a breadwinner, they want to support the family. So that might break, what about social service? We need to break down all the myths so we can get the dad feel confident. Yeah, I need that support as well. So it's just breaking down the barriers, myths. So what I know now, I wish I got the help quicker because I wouldn't have gone through what I did the second time round. Was horrific, for me personally. Ended up coming mental health teams and all sorts of things, so but it's all positive. And I was working in mental health then at that point, and I still didn't get the help because, like I mentioned, I thought it'll have an impact on my career, have a hope. Got a database, tells you what's local services actually in the area as well. So you put your postcode in, it might be local mental health services, and then the NHS mental health helplines. So there's Whitewall Project. There's loads of different resources. I'm not sure if I just mentioned that just now. Or
you did mention it earlier on.
Sorry, yeah.
But no, it's good to reiterate.
I did a talk this morning. I thought. So yeah. But like you said, when it comes to ADHD Foundation, ASD charities out there as well. Early assessment is always good. So yeah. So as a health professionals, for anxiety, we've got toolkits like the PHQ-9, GAD-7, post-depression, we've got the Edinburgh post-depression scale, validated for dads. But I would simply ask, how's your behaviours? Are you drinking more? Are you avoiding situations? I think men tend to more relate to that. Yeah, I'm drinking more. And I ask him, why are you drinking more? And they say, well, I can't sleep, Mark. Mine's constantly overloaded. And then we take and go down a conversation. You're not going to trigger anyone off by having a conversation with mental health. They're not going to go out and take their lives. There's no evidence that says that. It's different between thoughts to a plan as well. You could divert that. But yeah.
So I think obviously a lot of the children's nurses only get so much mental health training. So I think it's really good that you pointed that out. I think the benefit of some of the courses where you can do dual reg or have your mental health training in there as well means that you understand that a little bit better. And I think there's been a lot of strides made within nursing training now where they do get more allocated time to do some skills on mental health and things. So I think more education we can do about opening up a conversation. A cup of tea and a chat never killed anyone.
Yeah, exactly.
It saves more lives
than.
Yeah, it's really, really simple. And I
walk
think
and talk groups as well. Walk and talk groups, things like that we could do. Loads of things. Sorry, Becky.
No, it's fine.